Hello, I have Dr. Laura with me from States, Boston, and she's an implant surgeon. And I want to ask the questions that how to start implants in your practice, like for younger guys.
Of course, education is tops. We have a great video library at Bicon, and in general, if you can take out a tooth, you can probably place an implant because, especially Bicon, they're so short. Or you can have long ones, but you don't need long. Why waste all the bone?
Absolutely.
You only need short, and there's a different bone around the Bicon implant. It has blood vessels, so it's very strong. And as you can see, some of the
cases,
x-rays in the cases, you can have a very large abutment and crown with a very short implant, and it's a strong bone around it. So most implants work, but if you want a solution, Bicon's definitely your solution to must-have in every dental office, because the main reason I see people coming here first is to ask a question about a problem that no other implant can solve but Bicon. So
I think short implants in total in history they were criticized, but because Bicon it's a very unique design and a very unique connection, it just sets apart. Like
how come you're so smart? It's true. The Bicon implant has been around 40 years. It's the shortest implant with the longest history. Many implant companies are copying it, and it is a fabulous implant that I put in my own family. And I know many implants, but
I can vouch for that. If someone is using a system in their own family, I think that's probably your best system in the world.
That's true, very true. And you said how to get started. It's probably a very small kit compared to most implants. A very small abutment. Selection is big, but everything, it makes sense. It's what you need. Our thinnest implant, you can do individuals, 3x6s. You can hang a whole arch on 4x5.
Wow.
And if you look at this one, it is 4x5. Very small bone. That's the nerve. You can't get bone into that. Or you can't get an implant into here. So you put it between the anterior area where there's not a nerve.
Intermental area?
Yeah. And it's small. You must be a dentist too.
I'm an implant surgeon.
Oh, perfecto. So you have 4x5s. And you have Trinia, which is a beautiful material, a fiber reinforced material, and you have cantilevers. And the longer the better. I know it sounds like heresy, but it is true. The longer the better. And this is one of the examples. Another example you might see on the other side, but it's very crowded, on the other side.
I think it's really very crowded in this booth. So
I appreciate the interview. Thank you so much.
It's an insight for me. It's a learning experience. Like that is what I'm here for. So like you always learn from the best.
I think I could learn from you too. Oh, another thing, scannable abutments. Everything is digital, and you have an option of scannable abutments. You have tall abutments as well in scannable. So many times I extract, I place, I scan all the same day. The implant crown is waiting, abutment crown is waiting for me. But if you choose, you can take it out and tap an abutment in and scan for your crown. Or you can have the abutment and crown prefabricated or custom, and you can always cement outside the mouth, which is an amazing way. No screws, it's cold weld tapped in.
So 1.5 degree Morse connection is something which is...
But the 2.5 is for anterior canine to canine. There's 3 well sizes, 2, 2.5, 3. 2.5 is for your anterior to no dislodgement, even though the patients can grind something terrific, like
no, because of your insight, imagine this case being done conventionally. It's impossible.
Oh,
grafting, so many things.
It eliminates a lot of grafting. You know what? It's economical for the patient.
Absolutely.
And it's a beautiful, quick fix for the dentist. He can go home with rest and sleep because he didn't have to place very close to a nerve because he has a big, long implant. You can see on the other side, there is a 52 millimeter implant people have placed.
Oh.
It failed. When it fails, it comes out as pus on the skin. But they replaced it because they had enough bone to begin with. Why place a long implant when you have enough bone to begin with for a short implant? It's just risk and morbidity.
Absolutely. Short is less risky, less time consuming, and you have an amazing system here. So it's great. It's amazing talking to you, Dr. Laura, and it's a pleasure.
Thank you so much.
Thank you.
Keep up the good work.
Thanks so much.
Thank you.